Okay, now we've got our OPA in, we've got our NPA in. Are they very definitive airways? No. Will they work? Yes. As long as we remember to monitor our patient, keep their head elevated, we will be able to get air in this patient. Now, once you've done those airways, if there is no gag reflex, your patient does need a more definitive airway. BLS providers, as well as ALS providers, can utilize the King tube. This is a King tube. This is a BLS skill with Allegiance Mobile Health. This is why we are going over this. Okay, now, how to use a King tube. This is very simple. I believe just about anybody can do it. And if you ever have to use one in the field and you're ever confused, they have simple step-by-step instructions on the package. Now, one of the biggest questions I always get is which size is best for my patient? Well, King tube does it for you. If you will see, there is a number here. The number of the King tube is in the top corner. And if you look, there is how tall your patient should be. 3, 4, and 5 is what we carry with Allegiance Mobile Health. Look at that. There's also a chart on this inserted in here, which again describes about how tall your patient is. Will give you the indication of what size King tube you need. Inside your King tube package, you will find the King tube and a 60cc syringe and possibly some lubrication. If not, we have lubrication in our airway bags. So what you're going to do is while your partner is bagging this patient, you're going to prepare your King tube. You're going to take your 60cc syringe, you're going to fill it with 60cc of air. You are going to find the bulb reservoir. You're going to attach the syringe to the bulb reservoir, and you're going to fill it with air. Now, you're going to squeeze this bulb as well as this bulb. Make sure there are no leaks. Don't take too long because remember, you need this for your patient. This is not a game. Now you're going to take your air back out, and you are now prepared to insert your King tube. You can lubricate this. It will go in easier if you lubricate it. Maybe something to consider. Now, this is a very simple blind insertion technique. If you have an OPA in, you're going to want to take that out before you sit in your King tube. If your patient has a gag reflex, do not use this. You will be thrown up on. If your patient has a gag reflex, continue bagging with your NPA unless an ALS provider is on scene, and then they can go further. Now, no gag reflex, prepare to insert your King tube. Stand at the head of your patient, prepare your equipment, tell your partner to stop bagging because you are now ready. Ready here. Partner stops bagging, you take out the OPA if it is inserted, and you insert your King tube directly into the mouth. Show it from a different angle. We're going here and straight down. There are bite marks on the King tube, and that's what we're going to use as our guide. We're going to go to our bite mark, Usually the first one or the second one will do. Once you have inserted this king tube, you are going to fill it with air. You're going to take off the syringe. You're going to reach for your BVM, attach your BVM, and breathe for the patient. While your partner breathes, you will take your stethoscope and you will check lung sounds, lung sounds, lung sounds, lung sounds. If you hear lung sounds in all 4 lobes, you are in the correct placement. If you hear lung sounds here and here only, you are not deep enough. You will then take your BVM off. Withdraw the air. And you will insert to the next bite mark. You will then refill with air, reattach your BVM, tell your partner to do respirations while you check lung sounds again. At this point, you should have lung sounds in all areas. If you do not, you are not deep enough. But if you have gotten to your last bite mark and you're not getting lung sounds, there may be some kind of blockage, or maybe you're just not hearing, because by that last bite mark, you should be getting air into these lungs. These things work by blowing air from this port. One here, one here. It is not a direct insertion into the lungs. It is blowing the air from these 2 ports. So by that bite mark, you should have gone far enough to where that oxygen can be delivered. Now, once you do that, that is where you stay. You bag this patient and you transport. If an ALS provider arrives on scene and they have decided that a king tube is good enough, then the king tube will stay in place. But if an ALS provider arrives on scene and rules out that intubation is warranted for this patient, then they will take over and they will do the next step.